Guys, it's all about getting the absolute energy into the skin for effect. It's not necessarily getting it all in at once. So let me say that again, because that's an important thought. It's just about, over time, getting the absolute amount of energy in, not necessarily getting it all in at once. And that was like a light bulb moment for me. It took me many years to get there with my Morpheus. And then I just started backing down my settings before we started doing some of this other stuff. If you back down your settings, though, yes, you are walking away from a result on that treatment. So some things that you should consider if you back down your settings: increase your number of passes. There's no reason why you can't do 3 passes instead of 1 mean one at the same treatment setting. So instead of doing 1 pass at 40 kilojoules and your patient's hurt, just drop it to 20 and just go 2 or 3 times around. There's no rule saying we can't do that. They're going to tolerate that energy much better, and then you're just doing multiple passes at a lower energy. You should increase your total number of pulses. How do we do that? Well, you can start stacking. Remember that? You go in fixed mode, you can start stacking. Technically, if you do more passes, that will increase your pulse count. You can increase your density. Instead of overlapping 30%, you can overlap 50% or more at lighter treatment settings. That's another way to increase your pulses. Make it more of a dense treatment. Lower energy, but more dense, and then do it twice or 3 times. Or just, in general, do more treatments. Do 6 instead of 3, or 4 instead of 2. And just prepare the patient. Then, of course, finances come into play. Just thinking out loud here, you can set up a system if you have a different hierarchy in your practice. You have estheticians, you have nurses that you delegate to. In your esthetician's world, those patients are very used to coming in frequently. They come in for their monthly facials and their dermaplanes and their hydrofacials, right? They come in frequently for their skin care. It's easy to do your Morpheus at a lower price point, at lower settings, and delegate that to your esthetician. It's also safe, right, to do that. And just say, hey, if you're working with Riley or Kat, one of our estheticians, it's like, pick a different price point because you're going to have to do more because it's lighter settings. I'm just thinking out loud. Maybe if you go with one of the nurses, they have more advanced skill sets to be able to block you and control your pain levels better. So it's a higher price point, but you're going to get more work done per interval treatment. Does that make sense? So it just requires less treatments over time. But at the end of the day, here's what we want to avoid. We want to avoid a big butt. Sounds funny, but it's true. We want to avoid a butt. What do I mean by that? There's nothing worse than having the most amazing treatment for laxity, for texture, for fine lines and wrinkles, and it sounds like this. My treatment, look at these results. It was amazing, but fill in the blank. When they're spreading the word around your city, right? Or telling their mom or their sister or their brother or whoever, this treatment was awesome, but hurt like crazy. I'm not doing it again, right? We want no buts. We just want, this treatment is awesome, period. You should go see Dr. Maningas. He's so cute. He's got the best bedside manner. His office smells amazing, right? That's what we want. So we got to avoid the buts. Okay, so that's option 1. Decrease your settings. Don't be afraid to do it. You figure out the price point. You figure out who to delegate to, what that means in your world with your setup and your employees. And then do something more passes, more dense, more treatments overall. Those things are going to increase the pulse count, which is ultimately going to get more energy into the tissues, more result over time. You with me? Okay, then there's the other side of the scale. Like, I just want hot and heavy. I want your results. I just want to cram it in. And I want to make a big change in one treatment, right? Because truly, the net effect, the amount or the degree of change that you could achieve directly relates to, at least within your control, those settings. There's a lot of things out of our control, genetics, weight loss, weight gain, current status of their tissue, right? Smoking stat. There's a lot of things out of our control, but at least in our control, it's a direct correlation between those settings and the change that you can make. And it's obvious, the higher the settings, the greater net change over time, potentially, if you're trying to get one done or a lot done in one time, okay? So you're like, oh, I want to live in that world. I want to just cram them with the energy. Okay, so then we have these opportunities that we need to talk about. Everyone starts with topical. Everybody gets topical, period. Everyone gets topical, okay? And then if that's not going well, you can either decrease your settings, but you just said, oh, I don't want to do that. I want to give a good treatment. Okay, then we up our level of anesthesia. And for me, just to be clear, it's not a ladder where I work up this ladder, work down. All of these are on the same playing field. I just pick the easiest one or the best one for the context. It's not like I go from numbing to Pronox to this, it's not like a ladder that you escalate up. Does that make sense? These are all just tools, and I just grab the one that fits the scenario. So maybe the easiest thing, because I'm working in there's one tender spot, but the rest is going really well with the topical, but maybe on the top of the lip is just exquisitely tender. Maybe I'll just whip out that Pronox really quick, because I just need it for like 30 seconds. I just need some relief for 30 seconds, because everything else is going great. So maybe for that scenario, the Pronox is the easiest. Does that make sense? So it's not just like a ladder that I'm escalating up or down. It's just I'm grabbing whatever makes sense for the current context of the patient.